Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
Most of the braces or knee sleeves that we see people wear probably do absolutely nothing for their osteoarthritis. Matter of fact, they definitely do nothing for the osteoarthritis itself. There are braces called unloader braces, which are kind of spring-loaded. So let's say the medial or the inner side of the knee is bone on bone. Well, the brace will help open up. It's kind of a bulky brace, so that's a con to it. But the pro is it kind of unloads or takes the pressure off that really arthritic or worn out area. And so it can help a lot with symptoms. And so most people who try the unloader brace, they feel symptom relief when they're wearing it, especially when they're walking and weight bearing and putting weight on it. But after a while, compliance becomes an issue because it's a bulky brace and it does create some pressure on the skin because you're trying to kind of almost spring load, open up that side of the joint that's more worn out. So it can cause some pressure on the skin. And eventually people get sick of wearing it. Frankly, it's a big bulky thing on the outside. And they've made them less bulky, but they're still kind of bulky. So that's really the only brace, though, that probably technically makes the most sense for someone who has arthritis. Now, a knee sleeve, like a copper fit sleeve, or, again, that's just a brand name, but those type of knee sleeves, they sometimes help people feel like there's some support, trick them into feeling there's some support, and they also may keep the knee warm, especially in where we live up here in Syracuse, which is cold in the wintertime and even now today. And so that warmth can help loosen up the joint. The problem with braces, though, inherently is then your muscles start to rely more on the brace. And when your muscles rely on the brace, your muscles get weaker. So the downside of any bracing is if you don't have a good exercise program to strengthen your muscles, you're actually going to lose some muscle strength. Another downside is a lot of people who wear those knee sleeves, especially when the weather gets warm, they get skin irritation, little pustules and zits and things like that, or rashes. Unless you have a torn ligament and your knee is unstable, a brace isn't really doing anything for you if you have arthritis. Some people even makes the knee a little tighter, so you lose some range of motion. Stiffness is a terrible thing. With arthritis, you don't want that. So wearing a brace, they don't move it or bend it or straighten it as much as they normally would because the brace is kind of bulky and it limits that. And so frankly, I'll just be honest, I hate braces for use with osteoarthritis. I don't think it does really much of anything. And more times than none, it does more harm than good. Muscles get weaker, knee gets stiffer, skin gets irritated. But if someone wants to wear a sleeve or it makes them feel better, as long as they're working on their exercises religiously and make sure they don't get stiff and make sure they don't get weak, if they like it, it might help their symptoms.